Welcome back after the break, guys. Imagine yourself without a nurse, how difficult it would be for a quick recovery.
Good morning everybody. Today we are discussing in this class about special mouth care. What do you mean by special mouth care? Giving the mouth care to the patient. Why we are giving the mouth care to the patient? Actually, why we have to provide the mouth care to the patient? Is any necessary? To feel the refresh to the patient. We have to provide refreshment to the patient because he will be always something, he is having the disease. Okay, in that time we will be providing the mouth care. And anything else, the purposes of mouth care?
To keep the clean microorganisms.
To free from the microorganism. We have to keep the patient from free from the microorganisms. That purpose we are giving the mouth care. And also for the fever patients, okay, and unconscious patients also we have to give the mouth care. Why? Because unconscious patients always, they will be keeping the mouth close only. Because of that there will be more microorganisms will be stagnated in the mouth. To free from that we will be keeping we have to regularly in a day, every 2 hours we have to provide the mouth care to the patient to refresh the patient mouth. And also in the fever patients, and also they will be having more microorganisms production in the mouth. That's why we have to keep on giving, we have to regularly, in regular intervals we have to give the mouth care to the patient. Okay. And this is all dummy, but also we have to think this is a human being patient. Okay, and before giving to the mouth care we have to set the tray, is it not? We need some equipment and some things to give a mouth care, is it not? So we will be discussing now the tray setting of the mouth care. Okay, this is a special mouth care set which is having, this is a sterilized one, because we are directly keeping all the things into the mouth. That's why it's a sterilization one. It's contain a kidney tray and a small bowel with the gauze pieces and a small tongue depressor and also artery forceps. Okay, this is a sterile mouth set, and this tray is containing cotton balls, okay, and glycerin. Why we are using this glycerin? To apply to the lips, because always the lips will be drying. To prevent from the scarings and all, we will be using the glycerin. And this is the feeding cup. Why we are giving taking feeding cup in the mouth care tray? In between we have to give the feedings. Okay, and by this feeding cup they will be taking the water and they will be cleansing the mouth and they will be spitting out. Is it not? Okay, and then this is the kidney tray and paper bag. What are all things we are cleaning inside, and that all the waste products we will be keeping in this. Okay, and this is the medication. What is this medication? What is the percentage of potassium permanganate solution we have to take? 1:6,000. Is it not? What do you mean by 1:6,000? One crystal in 600 ml of water we are taking. Okay, to rinse the mouth. Okay, it is action of the cleansing action. Okay, and this is the Macintosh with the towel, because we will be keeping under the chin of the patient, and that will be to preventing all the spillage or soiling of the patient and also bed also. Okay, now we will be going to the procedure. Okay, first, what is the step of first procedure? What we have to do? Introduce the patient and explain the patient. Now I am explaining to the patient that I am giving the mouth care. Okay, see, I am keeping the name of Mary. Okay, always to the patient we have to, we should not directly speak like patient like that. We have to, by the name only we have to call, and we have to explain the procedure to the patient. Right, now I am explaining to the patient. See Mary, because you are having a severe fever, for that your mouth is unpleasant. For that purpose I am giving the mouth care to you. It's not a painful one, but it will be provide you the cleansing effect and you will feel refreshed. Okay, like this we have to explain to the patient. Then we have to arrange the tray, and we are setting the tray at the bedside. Next we have to fan fold the top sheet. Okay, like this we have to fan fold the top sheet. We have to ask the patient to come to the side of the bed, foot end of the bed, and we have to slightly turn the patient one side then we have to support the patient, then we have to take the sterile tray, open like this, and we should not touch anything. Okay, before touching the thing we have to go for an hand washing, then we have to open the tray. Okay, I already told this contain a kidney tray with the cotton swabs and gauze pieces and artery forceps and tongue depressor. Why the tongue depressor? To open the mouth of the patient. Then we have to take, first we have to have a feeding. First of all we have to keep the treatment Macintosh spread between the chin to prevent the soiling of the bed and the patient also. Then first we have to little bit water we have to keep in the patient mouth to have a wet things, and we have to take before going to the procedure, first we have to give some little bit sip of the water. Why? Because to wet the mouth. See, I am giving the water to have an wet the mouth. Okay. Then we have to open the sterile dressing, and we have to take artery forceps, and also we have to take the medication. This medication we have to pour in the sterile bowl, and then we have to take gauze pieces. Okay. See, this if we are keeping directly like this, simply we are keeping like this, what will happen? It will be causing injury to the patient mouth, is it not? So we have to fully cover. How we have to cover? See, this is first end of the edge we have to keep inside. Okay. And then other end of the thing also we have to keep inside, and next nicely we have to lock it. Okay. Then we have to take the medication. What is this medication? Potassium permanganate. Okay. Other than this, what are other things we can give to the mouth care? Salt, potassium bicarbonate. Okay. Otherwise we can nicely give it the paste and brush. Okay. Then next what we have to take? Tongue depressor. Why?
To open the mouth.
To open the mouth. So I am opening the mouth, keeping the tongue depressor. Okay. I am keeping. Then upside down we have to, in circular motion we have to clean the teeth. Okay. After one side over we have to discard the thing. Where we have to discard? In paper bag. In paper bag. Then we have to take, clock it. Again we have to keep tongue depressor to open the mouth, and now this side. Okay. In circular motion we have to clean. Okay, like this till the patient feel refreshed we have to clean it. Okay. And after cleaning we have to remove tongue depressor. Okay. And we have to keep in the kidney tray, and this should be discarded in paper bag, and we have to take in a sips of water to gargle and spit into the kidney tray. Okay. After that we have to ask the patient till she refresh, we have to give the feedings, and we have to tell the patient to gargle and spit it into the kidney tray. Okay. After that we have to inspect the mouth for anything remaining inside, or any damages is there and all. We have to see for that, and we have to clean the mouth with the towel, and we have to replace the things. And lastly we have to ask the patient how she is feeling. Okay. And we have to report it in the nurse's note. What will report in the nurse's note? What it contains actually in the nurse's note? Time, medication, and the nurse's notes will be having. In the time we have to note the time. What is the time now? Yeah, 11:30 we have to note it, and in the medication column we have to write the potassium permanganate. In the nurse's note what we have to write? provided mouth care with the potassium permanganate at this time, and the patient feels comfort. Okay, then we have to replace the patient position, okay, in comfortable position, and we have to cover the sheet, and lastly we have to ask the response of the patient. Okay, is it understand by you? Yes, okay, will you redemonstrate to me? Yes, okay, any doubts? No. Okay, fine. You will be redemonstrating now. Is it now? Yes. Yeah, fine.
We'll take a short break at this moment, but do know more about this course only after this break.